Yeah. Good morning, everybody. I'd like to call to order the public health meeting on Wednesday, April 17th. And today is also known as the National Mustang Appreciation Day.
60 years for the Mustang.
There you go.
For the car or for the horse?
This has been around longer than 60 years.
Horse has been here longer.
Yeah.
Yeah, I think so.
And it's also National Bat Day and not the St. Louis one. It's the Louis Swinger or Singer, what for that. It is the mammal flying nocturnal bat appreciation.
That's
But it's-
bad.
Not the old bat day either, although we should always appreciate the old bats.
Yeah.
But it is National Blah, Blah, Blah Day, which is to celebrate casual talk. So with that, I'll have the clerk call the roll.
Juby? Here. Silva?
Silva is here.
And we have Tarver and Tarver.
here.
Williams. Yeah, they're all remote and absent. Yes. And then we have Strathman.
And Mr. Christian.
Tarver?
My phone is-
Yes, Tarver's here.
Sanchez?
Sanchez present.
Okay, and we also have a request for remote with Mr. Sanchez and Mr. Tarver. Is that all right with everybody?
Yes.
Yes, okay.
Madam Chair, Williams here.
Okay, did you put in for a?
I was tardy on my request for work, if allowed, otherwise I'll just listen.
Okay, all right, then we'll welcome Mr. Williams as well. Okay, well, good morning, everybody. And I understand we don't have any public speakers, is that correct? Okay, and we will, this is gonna go nice and smooth today. We have the monthly financial reports are attached, both for the health department and for the animal control. So, next, yes,
Could you announce that we're using Mr. Tuppy to make our quorum, please?
yes, I thank you, Mr. Tupi. And Mr. Tupi is part of our quorum in room today, so. Okay. All right. Brett, you're up.
Good morning, everyone. I have two exciting things. One is a week from this Saturday, April 27th from 10 to 1 p.m. will be our first vaccine clinic of the year. We're very excited. Again, continuing with the drive-through style, we've had great publicity already. Tons of phone calls about this that actually started in December. So everybody's very excited that we're back up and running with our clinics. And the other thing I'd like to announce is that Saturday, May 11th, and I put a bunch of flyers out by the door. We recently, Carpentersville partnered with us through the Metro West agreement to utilize our services. In speaking with the city, something they would love to do is be able to get more animals microchipped. So we started discussing doing a microchip clinic about 4 months ago. We're very excited that it's actually scheduled for Saturday, May 11th, 2024 from 8 a.m. to 12 p.m. at Carpenter Park. And Carpentersville will actually be sponsoring the first 50 Carpentersville residents. You must have an ID to prove you live in Carpentersville. They will be sponsoring the first 50 residents that show up to get microchips. So that's very exciting. And again, the cost of those will be $15 for the microchip, cash and check only. We just unfortunately can't do credit card out in the field sort of thing. But we're very excited to partner with them. And very excited to get this done. So that's going to be a lot of fun. We've also been doing a lot of training with their officers on how to scan for microchips. So they've been a wonderful partner and a great addition to our animal control services.
That's a great service.
Yes. The other thing was, I know the board has recently been discussing the option of a therapy dog. Animal control would like to throw out the option of being able to bring a dog to the board meetings, an adoptable dog, of course. Someone that has passed our rigorous behavioral test, passed our medical evaluation, and is actually current on the adoption floor. I know it's not exactly the same. I do believe in animal therapy 100%. I see the positivity of what it does, what it's done in hospitals, what it's doing in our court systems, and I fully support that option. I just know that the cost of animals are rising every year. We estimate around $1,500 to $2,000 now per year to take care of a dog, and that's just additional fee. This way, my facility would be taking on all that responsibility. We already have staffing to care for after hours, weekends, holidays. We already have the food, we already have the medical care, we already have the veterinary system in place to be able to do this. It's a win because King County Animal Control would be able to show off the great work we're doing, and a win for an animal that could potentially find an adopter at these board meetings. It's just an option I wanted to throw out there that is something my department would 100% support and be behind to help in any way we could. Because again, we do understand the importance of these sorts of things.
Any comments or questions? Yes.
Yes, of
Dr.
course. Good morning. I am all for that. And I don't see why we couldn't look at a couple of options concurrently, but I commend you for advocating for your department, for commending for the animals. And as a sucker who's already fallen for those cute little things, and I have one of my own from your department, I would love to see more people kind of fall into that trap, quote unquote trap. So I think that's a great idea, and it's very, very smart of you to bring that up as the director of animal control. Thank you.
Thank you.
Yes, Ms. Juby.
Okay. As another foster fail, would that dog, would it be coming to different dogs? Would a dog be coming to all the meetings or just one?
Definitely a discussion to be had. The beauty is it's in the morning. We could have someone come out here, be present for the meetings. That is definitely something I could work with. If dogs don't work that month, we could discuss cats. If we have a box of kittens, like right now I have 5 kittens that would have been fantastic to bring, but I also understand people have animal allergies. So I want to be respectful to that at the same time. I am open to whatever the board wants to do. I mean, again, our shelter's literally across town here. Animals can quickly get here. I can quickly take them back. I can have different animals here. I just think it's a great way to also promote some of these animals, get seen by different people that come to these meetings in a way to alleviate stress. It's also going to be great for these animals too, for enrichment. And the more people they see, the better they're going to be in the community. So it really would be a win for some of these animals in the shelter. But again, I also respect whatever decision the board wants to choose.
Oh, no, I think it's a brilliant idea. Brilliant. So thank you.
Any other questions or comments?
Lewis is
Just-
online.
Yes, Ms. Lewis.
Okay, thank you. Mr. Youngstead, when we brought this up as new item at our Human Services, I kind of got tasked with this, so I would love to meet with you and kind of see what we can put together. And of course, we're going to have to talk to HR and, you know, all the powers and find out exactly how it would work. But I'd like to work with you and get something together and bring it before the board, because I definitely think it's something that we need to pursue. So thank you for mentioning it this morning.
Perfect. Of course. And I will follow up with you after the meeting. Thank you.
Awesome. Thank you.
Okay.
Madam Chair,
Yes, Ms. Bates.
Bates, please. I am very allergic to cats. I'd like to put that one way on the back burner, please. Thank you.
Well, yes, I understand. I also am very allergic to cats, but love them. And I think that that's something we'd have to figure out how we
Oh,
would do it. You know,
100% understand. And that's why, sorry.
And some people are allergic to dogs as well. I don't know. My daughter's allergic to dogs. So it happens too.
did you
Yeah.
say your dog is
Oh,
allergic to
daughter.
dogs?
Yeah.
No, my daughter. But
Dogs, different.
Yes, and that's why
and-
understanding of allergies would be very important. And that's why I brought that up, because I do want to make sure that people still feel comfortable coming to this facility. And I wouldn't want anybody to not be comfortable at any time.
thank you. And the purpose of this would be, I don't quite understand the purpose.
Well,
Okay.
I think I can maybe answer that for you, Ms. Bates. I think it was kind of born out of the conversations about having a support dog. In another meeting, it came up, and it just, I think, is something that maybe the time has come. Dr. Silva.
Yes,
Well,
thank you.
What, maybe I don't know exactly what a support dog is. Are we, will this dog be up by Blair like his dogs are, or?
Yeah.
Well,
What do
this
we do with the support dog?
So
This would-
can I jump in? Or
Yes,
Sure.
somebody ahead of me?
go ahead.
Okay, so I was the one who brought this up along with Ms. Juby and Ms. Gums. And as Brett mentioned, Court Services has a support dog. The jail does. the school districts now do. The dogs are just something that kind of take the edge off your day. You know, even at the board meeting, to come in and have an animal to kind of just pet and take a little stress out of the day or after the meetings. It's a lovely thing to do. Of course, we've got a lot of thinking and a lot of, it's a little bit of a premature, you know, talking about it, but, and yes, we have to take into account allergies and the dog would probably be up front someplace in a corner. But it's just something, initial stages that we're going to explore. There'll certainly be more information and more things brought to the board before we approve it.
Exactly. It's just an idea who we're trying to flesh out a little bit and see where it goes. Yes,
Okay,
Dr.
thank
Silva?
you.
Maybe we could bring a bird in too, Mavis.
Birds would be great as well. They need homes too.
Yeah.
So
Bless you.
I guess I would say that the pertinence of this is that there is a national issue with animals, not only past COVID, but our shelters are full. And these animals are being kept in enclosed spaces. Some of them are nicer than others, and some of them are really ugly. And they're being kept in shelters for a year or 2 years, some of them half their lives. So anything that we could do or anything that I could do as a board member to bring attention to this national issue that is so painful for so many people, I think I'm all for it. There are some dogs that will trigger more allergies than other, right? So we can kind of take a look at that. We can take a look at maybe allowing certain things. And if there's an issue, we can always pull back. I will admit that I actually bring my dog to my clinic with me. She sits in my office and she actually has a great temperament for this. So I haven't had an issue with any patients. And of course, I'm very, very careful with that. And I'm watching out for it constantly. I'm not suggesting that that's what everybody could do, but I think that it is something that we need to help our staff. We need to find ways to save money because it does get very expensive to house these animals. So this is an astute way of exposing animals to potential adopters. So thank you.
Madam Chair Bates, please.
Yes, Ms. Bates.
In the past few years, I've been bitten twice by dogs who never bite. Yeah, sure. I get distracted by dogs. So I just want to say that's all. I'm not crazy about dogs. They bite.
And I'm not laughing that you got bit. I'm laughing that these are some of the things we'll have to talk about. We'll have to figure out all the parameters and we'll have to figure out which meetings are appropriate. And if there is going to be a dog here, you will not be required to touch it. So
I wouldn't think so.
Yes, we'll let you make your own mind up about that. But it's just I think it's an idea that we need to talk about. And Anita, if you will help Brett Youngstad with that would be great. And talk about all the parameters and cautions and conditions. And I think it's a cool idea to pursue. Okay.
The research.
Chair Sanchez here.
Yes, Mr. Sanchez.
Thank you, Madam Chair. I'm just curious to know what is the name of Dr. Silva's rescue dog?
It was Cece. They named her Cece, but it is now Lucy. So she goes by Lucy Lou, Lucille Ball, any variation.
Or Lucece? Okay, thank you.
The research has been done nationally to show how amazing these support animals have been for people to decrease stress. They say just playing with an animal for like 5 minutes can decrease your stress level so much. And then, yes, like Dr. Silva said, on the positive of the animal side, that this animal is getting increased enrichment out of the kennel around more people, potentially to see an adopter. It really becomes a win-win, which is why I wanted to throw my name in. And again, I understand we're at the very beginning of this. I just wanted to throw that out there as an option to see if there's a way to promote a department and to show off the work we do. And there are other options I have available should we not have an animal ready sort of thing that I think would also partner with some of our local groups here. That really would be a win, not only just for us, but for the community itself.
Sounds like a fine idea. So, okay. Thank you for that.
Thank you.
We'll wait to hear what you and Miss Lewis talk about. So, thank
Thank
you.
you.
Oh, we didn't do the minutes. I beg your pardon. I was jumping right into a blah, blah, blah day. Okay, could I, could I have a motion and a second to approve the minutes from March 20th, 24?
Juby makes unanimous.
Jimmy, make,
consent. What do
Okay.
I do? I
Make
never do
unanimous
unanimous. I
consent.
always want a voice vote on everything. So unanimous request.
yes,
Unanimous
Yeah.
unanimous consent.
unanimous consent does not require a vote. It only requires the absence of an objection.
So moved.
It's okay. So with no objections, the minutes are approved. Okay, thank you for that. Thank you for that. Okay, now moving right along, we have brought up again with another.
Yes,
an
our
ordinance
first one
today?
is our amending our fee schedule. This fee schedule was actually set in 2006 with the most recent update in 2013. The update in 2013 is not, or 16, excuse me, please excuse, I'm sorry, it was 2016 was most recent update. None of these fees that are being updated right now were changed. So these were the original fees that are being updated from 2006. The big ones to note are the boarding changes, of course, the top section. The boarding changes went from up to non-neutered to 50, neutered to 25. There will be an after hours fee for when we're closed, basically sending out that warden on time and a half. We're just trying to balance out some of that funds that we're paying for that warden. It's usually about 2 hours that they're out in the middle of the night. Owner surrender fees are going from 20 to 50. This is due to the cost of how much is putting the stress onto the shelters. The low-cost euthanasia service that we've discussed over the previous 2 meetings, and the stray animal pickup for third and subsequent offenses for those animals that continue to run loose and continue to cause a burden onto our facility and the society as a large.
Okay, can I have a motion and a second and possibly pass this ordinance?
Juby moves.
Okay, Juby moves. Do I have a second, please?
Tepe seconds.
Did I hear a second?
Tepe.
Oh, I'm sorry. Thank you, Mr. Tepe. Okay. Any questions about this? Yes, Ms. Juby?
Yeah, so I have a pesky low-cost euthanasia question. I'm going to preface it with, I think all of the other fees are fine. I think that the ability on the low-cost euthanasia to offer that service to people who need it is fine. I am not okay with them not being able to be there. Although I realize that while we hate to admit it, most people don't want to be there. So while we all think, oh no, they all want to be there, they don't. And that's okay too. However, if someone is going this route, I would like them to make an appointment with you so that they can come in and the dog doesn't, or cat doesn't have to sit around in some strange location before it, has to be euthanized. Still not sure I'm okay with the service, but with that parameter, I think that I would give you a conditional approval and have us check the data, how many people are using it, how many people have you had to turn away because they didn't meet the rigorous standards that you are putting forth.
Ms. Judy,
Yes,
I'm sorry to interrupt you, but this resolution, this ordinance, it has only to do with the fees.
right. But the point is if we don't offer that service, we shouldn't have a fee schedule here. So if we're going to be, if we have a fee schedule for that, I want to make sure that these things are in place. So if we're not going to be talking about that, I would like to strike that from this resolution.
Well, I think we discussed this last time and we talked about the way that would you like to take
Please.
this over? Okay.
100% agree with you. Everything you're saying, 100%. If I may take a moment to walk through the process, because I think it's very important to understand exactly what we're doing, because I want it to be very transparent. This is a process where, yes, it is 100% appointment based. It will only be on Tuesdays and Thursdays. It is going to be to the person will come to our facility, will drive to the garage area and not be anybody near the front desk. Don't have to come in and be near anybody at the front desk. I don't want them around people because that's not fair to them. They'll pull around to the garage, they'll contact us, we'll come out. It's going to be something scheduled. So it isn't. I don't want that animal waiting either. But we do have to prepare for the 100-year flood. And that's what we are preparing for is if the animal needs to sit, where will it sit? Where will it be? How will it be handled? And that is things we're working on right now because I don't want it part of, if I may use a jail term, general population. It shouldn't be. That's not fair to that animal. The goal in everything we're doing nowadays is how do we decrease stress in animals? We look at fear-free sheltering as a guide of how to make these animals happier, healthier, decrease the cortisol levels, increase their immune system so they can get out of the shelter. So I agree with everything you're saying. And yes, we've looked into all of that. They're going to schedule and talk to someone in my front desk. Initial conversation, initial discussion over the process. Then they'll schedule an appointment. They'll receive an email with a bunch of information about other resources, about other things they can utilize, other services they can go to, other ways to, for lack of a better term, not to euthanize their animal. So we will also be providing them with resources so that they can make other options and other choices. We do this with our owner surrenders now, and we've actually found it's a decrease of about 20% of our owner surrenders because they've found additional resources and ways that they're able to better handle their animal through low-cost resources. So it is definitely something we're looking into. When the person comes, they'll meet with an additional staff member, actually 2 staff members, and then the evaluation of the animal will occur. All these processes are also going to evaluate whether or not they're being truthful to us. I've been in this industry for over 25 years now, sadly. I don't talk age. But I've seen the people that are lying to you, the animals that need to get this, the animals what this service is meant for. I did this service for 3 years at City of Chicago, and I've seen the people that I'm just mad at my husband, which is why we're making it very clear we're not doing those sorts of things.
So this has changed since the last time we had the conversation because I'm not aware of any of these things that.
It's a process, like I said, but we're continuing to work on. I take it very seriously.
Oh, I know you do.
I continue to have these discussions with my staff when there's a break in the day. They hate me for it, but we continue to discuss what is it we're doing and how are we trying to accomplish it? Because if this isn't a benefit, then there's no reason for us to do this. Since our last meeting, we have had dozens of phone calls asking us how soon the service will be up and running because they need it now. Again, we refer them to the places that are currently offering the services, but I know that those services are also burdened themselves, which is the reason we were looking to bring this on to make this something for our citizens that they could have at their ready. Yes, the majority of people don't want to be present. It isn't something I would do. It isn't something I know you would do. This is a personal opinion that I don't judge on. Just like how someone reacts in an emergency, everybody reacts differently. I can't tell you how to act. I can't tell you whether or not to be there for your animal. I can't tell you whether or not to keep your animal inside or outside. I'm an inside animal person. That's just me. But I also understand that, all these uniques are what makes the world go round. These are what makes it such a beautiful place that I want to make sure we're able to accommodate those people. And to those that do want to be present, Anti-Cruelty Society offers an amazing experience. I do highly recommend them. And to those people that need the low-cost service that do want to be present, I recommend going there. And that is something that maybe down the road, if there's ever a grant for this, we could look into potentially do it here ourselves. Like they have grief counselors. They really do a beautiful job.
And when will we be looking to start this service?
If it gets approved, I still need to order equipment, which would take about 3 minutes to come in. I need to ensure that there's a full protocol written and detailed about how this will be done. So we're estimating about 3 to 4 months. We're looking about August to September.
Thank you.
And so at this point, this is just for, to include on the fee schedule.
Correct.
And we're still working out the parameters of all that. Yes.
Chef Rowe, a special ASA. I think as you pointed out earlier, this is a proposal to amend the fee structure. And I think it's a necessary first step. You don't want to be in a situation where somebody comes in, meets all of the criteria, but if there's no fee established, arguably there's no authorization to perform the service.
Correct.
And so I think this resolution is not the place to discuss or to put in detail a description of the service, but is something that, as I understand it, Mr. Youngstead would be developing and would need to develop before you could actually offer the service.
Correct.
And I presume that if the board wished, that description could come back to the committee or the board before you actually implemented the policy. But if you did it the other way around, then you'd have to go back through and establish a fee for the service that you want to offer.
Correct. And that's why, like, it's going to take time, because this is what I was told was step one. And I want to make sure that I follow the guidance of the state's attorneys and followed it in a proper order.
Thank you, but I'm not sure I can support it. Sorry.
Understandable.
Okay, can I ask you, you do not support the increase in fees?
No, I'm fine with the increase in fees. I'm not sure I can support a fee for a policy that hasn't been written yet. I'm having a hard time with that. I know that you say this is the way to go forward. This is backwards to me. I think you have a policy, you vet out the policy, you set the price, and then you ask for approval. So I'm okay with everything but that. And if I can't be okay with everything, I can't support it. Now, if we were to take that out and have it come back on its own as a standalone, I would be fine with this policy.
Well, I think that what Mr. Youngstead said is this is the advice he got from the state's attorney's office on how step one for this. So I think we'll have to go by that. So you'll have to vote the way you feel best. So, okay, Dr. Silva.
Thank you. And I wasn't sure if Mr. Tarver had his hand up before I did, but I do have some
Okay.
comments. Would you like to go next, Mr. Tarver?
Thank you, Dr. Silva. Go ahead, I'll wait.
Okay, thank you. I didn't mean to take over.
Oh,
My
that's good.
apologies. I actually agree with you, Leslie. And I have to admit, maybe I'm just too emotionally attached to the subject for me to make this decision, but I'm trying as an effective board member to put that aside and look at what I'm actually voting on. And I agree with you because I don't understand the parameters. I don't understand what the guidelines are going to be. Actually, to be very honest with you, I don't even know if we offer this right now. And I hate to admit that, but I need to know more before I can vote on this. So I'm on board with you. I think the state's attorney has an idea of how things should work, but also we as board members also have our own idea of how we work. And for this to work effectively, we need to work together. So I can't go with this advice when my responsibilities as a board member are telling me that I need more information. So I agree with Ms. Juby at this point.
Okay, well, I had the advice of counsel here. If you would like, we could amend it this morning to not include that particular fee so that we're not being held up on all the rest of the fees. And then we could move forward with when we do have the program in place and treat it as a whole package. So do I have an amendment to the?
I think Mr. Tarver wanted to speak,
Oh,
but
I'm
then I
sorry,
can make
Mr.
an
Tarver,
amendment.
yes. Mr. Tarver?
Thank you, Madam Chair. Very similar. Brett, thank you very much for clarifying the information about what the possible process would look like. And Mr. Shepro letting us know too. I think I have very similar sentiments. I was surprised. We have had this conversation in this committee, but I did not realize that the fee structure was based on trying to initiate this process into the county. So I think I would support, based on what Dr. Silva and Ms. Juby had shared, would be also in support of an amendment that would perhaps remove that so that does not obstruct the additional fees from being increased. And then once we have more information regarding the process of euthanasia and the price structure, we could include that together.
Okay.
Thank you, Madam Chair.
Yes, so I think that is the way to move forward this morning. So if I could have, if you would like to state an amendment.
Mr. Tepe had a question.
Yes, Mr. Tepe.
Thanks, Madam Chair. Tepe here. Brett, I wanted to ascertain if you'd looked into the volume that you might anticipate of people using this service and how you'd be able to handle that.
Mr. Tepe, can you use your microphone, please?
I thought I did. Okay, Brett, can you look in, what is the volume that you might anticipate of the people using this service and how would you handle that?
We are not expecting a large volume. We're expecting initially when the program starts, we know that there's going to be those people that have been sitting on the fence and financially have not been able to do this, that we'll get in, we'll get that initial rush. But even looking at what I did in the city of Chicago, the numbers aren't as high as you would believe. We're talking maybe 2 to 3 people a month, if that. And I think that may be even estimating a little high. The reason we're doing it only on Tuesdays and Thursdays is that's the day I have the max amount of staff overlapping to the longest part. So staff wise, it made the most sense to handle it this way where a staff member can be utilized. But again, we still have to prepare for the 100-year flood, that if there's a massive hoarding or cruelty case, we could have all hands on deck for a situation like that. But again, we're not expecting a super high volume. Again, looking at Aurora, looking at City of Chicago, they're not even always doing it weekly. So we're not expecting this to be an overrun service. It's for those few people that need it. We want to be able to have it. Thank you.
Yes, Dr. Silva?
Thank you. And so I heard you, did I hear you correctly? Like in case of a hoarding situation? Did you just?
We would be offsite. That's the 100-year flood we're preparing for, where if you brought your animal at that scheduled time and we're not able to do it right then, it would be because when there is a cruelty case or a hoarding case or a big case like that, we're a small department, we're all hands on deck. So even I'm at the hoarding situation, so no one would be at the facility to perform it. So that's where I would have to prepare for that animal to kind of sit for a couple of minutes.
Oh, I
till someone
understand.
gets back.
So while you're taking care of a hoarding situation, you need to have adequate staff in
Correct.
case somebody
Yes.
wants to. Okay, that was my question, because wouldn't a hoarding case apply under different circumstances?
Yeah, they're
Okay.
two different situations, but Ms. Juby asked about, will the animal ever have to sit? And that's why I said the 100-year flood, that I don't want to say never because things happen. It's the world we live in. So those are situations like that where we're all hands on deck, everybody's out of the shelter assisting, that we want to make sure that that animal would have a place to go that's safe, secure, private to itself.
So I understand we do offer euthanasia under some circumstances. And so this is to offer euthanasia for folks who have an issue with their pet.
We do not offer euthanasia to anyone, to the public
We
at all.
right, but we do euthanize animals.
We do euthanize,
We do
correct,
euthanize
just
animals.
not a service offered to the public.
Okay, so this $100 fee is a starting fee to bring this program in.
Correct.
And then, so what's important to me are the parameters of, is it going to be only for sick, older dogs? You know, what are the parameters, or,
Yes.
you know, at what age is a senior animal going to be euthanized? Those sorts of things are important to me. And I know it might not be part of the discussion now if we're going to amend this.
No, and 100% correct. And I don't like to put age, sorry, and I apologize. I don't like to put age limits and saying just because it's a senior, it gets euthanized. It's more quality of life. Because that would be saying that all animals that hit 10 years old must be euthanized. That's not fair. This really is a quality of life service. That's what this is meant to be. The animal is too aggressive. It's harming, people or children inside the house. This is an animal that is uncontrollable cancer that they don't know what else to do. We're talking sick animals. That's why I'm saying, after having done this for years, being in this industry for so long, the animals that need to be euthanized and those I can get to rescue. There's tons of wonderful senior rescues outside. Yes, everybody's full right now, but there are great senior rescues we would continue to work on or maybe adopt, because there are people looking for senior animals that they would then turn around and go to our adoption floor, sort of thing.
So at this point, what I would like to do is I'd like to have an amendment and a second, so we can move on, and then we can have some more discussion when we do bring it forward, this whole item of euthanasia. And I'm sure the input of people on this committee would be very helpful to establish the protocols.
Correct.
Right now, I'd like to have an amendment in a second.
I'd like to make a motion to amend the resolution to remove low-cost euthanasia fee of $100.
From
Do
the
I-
ordinance for
From this resolution, I don't want to kill it. I just want to remove it from this resolution. Do I have to say anything else, or is that just
Just removing.
just removing this? I'm removing the line item of low-cost euthanasia.
That fee.
Okay, and do I have a second?
Silva was second.
Okay. And now, can we do a voice vote on it?
You can do a voice vote. to
Okay,
remove it.
we'll do a voice vote to remove
Uh,
that or to
discussion?
support the amendment.
Well, why don't you take a roll call?
Okay. All right.
Is
we'll
there
take-
discussion on the amendment?
Yes.
Yes, there is a discussion on the amendment. Mr. Sanchez, you've had your hand up for a while.
Yeah, thank you, Madam Chair. I guess I just don't recall us really approving policies, internal policies for departments. I know as a board, we approve policies for the county organization as a whole. And I guess I think I have faith in our directors to adopt policies that are appropriate, especially given input. And I know that this is a bit of a sensitive subject. I'm just thinking, okay, if he comes back with a policy, we approve it, but then he needs to make changes to that policy. Does he bring that back to the board? I just don't recall that happening. And it feels a little bit like micromanaging to me personally. I have faith in Brett to execute, this program, in a way that will satisfy everybody. So I'm not in favor of the amendment to remove this. I think let's just keep it all together and then he'll work on putting that policy together. Thank you.
Okay, so we have on the floor, we have an amendment to remove the euthanasia fee from the ordinance of increasing the fees for the department. So we will vote right now on the amendment and we will do a voice. Any more discussion before we take a vote on the amendment? Okay, please call the roll.
Juby,
Juby, I.
Silva. Yes. Carver,
Carver, yes.
Williams,
Williams, no.
Sanchez,
Sanchez, no.
Strathman,
Yes.
Tepe.
Tepe, no.
We have, it passes. There's four.
Okay.
Yes.
So we will, so we have removed the line item of the fee for the euthanasia, which is a program not in place yet. And so now we need to have a motion and a second to vote on the ordinance as
So
it.
you actually have. Well, if you don't have a motion, you should have had it. That's my fault.
Did we?
Is there currently? Yeah.
Okay,
Wasn't there a motion to approve this?
yes, there was.
Yeah.
Yeah, okay.
So that,
Yes,
now this would be a vote or further discussion on the proposed resolution ordinance as amended.
as amended. Okay. Did everybody get that?
Madam Chair, could you please ask Mr. Shepard to repeat that in the microphone? It's hard to hear online, please.
Sorry.
Thank you, Mr.
Yeah.
Tarver.
All right. There having previously been a motion made and seconded to approve the amended fee structure as submitted in the packet. There then having been a motion made, seconded, and passed to amend that by striking out the reference to the euthanasia fee. Then the remaining matter before this committee is the original resolution as now amended to delete that provision.
It's already
Everybody clear
deleted.
on that?
We already deleted it. We voted to delete it with our amendment. So,
That's what I said. The
Yeah.
oh, I'm
Right.
sorry, I misunderstood you.
matter before
Thank you. Thank you for the clarification.
As
Amended, as
by
amended.
the deletion.
Oh, by the deletion.
Okay. Is everybody clear? Okay. So a yes vote would be to vote for the new fee schedule without the euthanasia fees included. Okay, please call the roll.
Juby,
Juby, I.
Silva. I'm sorry, I have a question. I wasn't fast enough in raising my hand. Could you please repeat what the changes are while I look at that? Those are the changes we have, those are the fees we have now, or?
No, these are the new fees.
Okay, so what was the fee for the?
The
rate?
non-neutered was 35 and it's going to 50. The neutered fee was 15 going to 25. The after hours fee was 0. So we were paying for a time and a half for each one of our wardens that make the most at our facility. The owner surrender fee was 25. That's going up, or 20. It was $20. It's going up to 50, which is actually in line with all of our surroundings, and some of them are charging more. We're trying to keep it as reasonable as possible. And then the stray animal pickup for third and subsequent offense having an additional fee for those people that pick up, because we keep having to go out for the same animals, because these really are penalty fees, and that's how they pay their fines.
Okay, I will vote yes. Thank you. Tarver,
Carver, yes.
Williams,
Williams, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
and Tepi.
Tepe, yes.
Passes. Okay, so now on the next resolution, everybody should have gotten an email about that with some changes. And I'd like to ask Mr. Ford to step up and tell us, explain this so we're all sure we're knowing what we're doing here.
Thank you, Chair. Stephen Ford from the State's Attorney's Office. So, before you, make an amendment, I just wanted to point out the reason for the email was, the version of the contract that was attached to, the resolution in your packet, was the vendor's contract. So it contained all of their terms, in the time that the packet was submitted, to the county board office. And today the vendor came back, and reviewed edits that the county had made, standard edits regarding shortening the term to a 2-year term, indemnity and termination for convenience. So I would just humbly ask for the committee to entertain a motion to amend the contract to ensure that this committee, or amend the resolution to ensure that this committee, committees that follow in the flow and the full county board can ultimately approve execution of the final version. If you have any questions, I'm happy to ask either once a motion is made or once you're discussing the resolution.
Yes, Mr. Shepherd.
Yeah, Mr. Ford, would it be acceptable for a motion to approve the resolution with but substituting the replacement contract that has been submitted?
Yeah, I think it's appropriate.
Okay, does everybody get that? Yes, Ms. Juby, you have
No,
a
I
question?
was gonna put forth the motion to approve with the
Updated.
updated substitution language provided in the external communication.
I think you could say
Forwarded
that to substitute with the final version of the contract.
Substitute with the final version.
Okay, thank you. Do I have a second? Dr. Silver seconds. Any discussion? This is just a little housekeeping is what it is really. So, yes.
If I may, it's also going to allow us to be able to sell tags online. So
Oh, nice.
we're very excited to finally have that feature. So that's going to be a huge boost for us.
Okay. Okay. Call the roll.
Juby,
Juby, aye.
Silva. Silva, yes. Tarver,
Carver, yes.
Williams,
Williams, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
Tepi.
Tepe, yes.
So, Shepro, this will now move to the next part of the committee flow with the new contract, proposed contract substituted.
So it'll go through the committee flow. So thank you. Okay. All right. So thank you for a
Thank you.
big morning here. And now we'll move on to Director Isaacson.
Great. Good morning, everyone. I'll be brief, just in the interest of time. Just a couple of things I want to highlight. Number one, we are closing in on being able to present the data that we've collected through our community health assessment process. So again, that's something we do every 3 years. We do it in partnership with our 5 hospitals that are located in King County, along with the Inc. Mental Health Alliance down in Southern King County. So that information will be available to you shortly, and I'll be scheduling meetings if you're interested to go over any information that may be pertinent to your district. So more to come on that. Also, just want to give an update. We do continue to monitor the measles situation here in the Chicagoland area. You may have seen in the news that DuPage County, Will County, Lake County, Cook County have identified cases. So we currently have not identified a new case of measles. But it is something that we're working with both the Illinois Department of Public Health and our partner health departments in the region to monitor. I don't know, Director Unwood, anything else you want to say about measles right now?
Thank you, Director Isaacson. Just to point out the importance of vaccination, making sure everybody knows where their vaccination information is so that if in a situation that you're exposed, it doesn't interrupt your normal business, because once you have your vaccination history, we always want to see a proof of vaccination. It's not enough to say that you're vaccinated. One thing to note is that during this outbreak since March, Chicago has given about 15,000 vaccinations. This is the one important reason why they were able to contain this outbreak. So, vaccination is still the prevention for measles.
Excellent, thank you. And now with Chairman Strathman, we've talked about how we want to highlight a different program at the health department each month, just so people can see a little more what it is that we do. So we're excited this month to talk about our tobacco program. This is kind of close to my heart. 24 years ago, when I started at the health department, I worked in the tobacco program initially. So I'm pleased to introduce Tina Corral, who is our health promotions manager at the health department. And again, just a quick plug for Tina. Most of the graphics, if you follow us online, she does a wonderful job just presenting and really making the health department look good. And that's one reason why I don't want slides today, because I don't want my slides to pale in comparison to how nice these slides look. And also we have Nathan Ritzma, who is one of our community initiatives coordinators who works in the tobacco program. So I'll bring Tina to the podium and she'll share a little bit about the program. Or Nathan, whoever.
Actually, Nathan is going to
Okay,
start.
perfect. Here's Nathan.
Hi, everyone. Nice to meet you. My name is Nathan Ritzema. I'm the Community Health Program Coordinator for the Tobacco Prevention and Cessation Initiatives, as well as the Kane County Fit for Kids program. And I am excited to talk to you about our program. Oh, there we go. So first of all, just some background on tobacco. It is a huge cause of premature death in almost 500,000 Americans each year. In the US, it is the #1 cause of preventable disease, and it contributes to other profound disability and pain. These diseases include higher rates of stroke, higher rates of pulmonary and respiratory failure and disease, higher blood pressure, and higher incidence of multiple cancers, including lung and mouth cancer. And smokers are not just a cause of pain to themselves, they're also cause harm to the people around them through the negative health effects of secondhand smoke. And in addition, I just want to clarify, we encounter common misconceptions about the use of e-cigarettes. When we say tobacco, we do not just mean cigarettes. We also mean cigars and e-cigarettes, which are unsafe for teens. Many people think that they are a replacement for cigarettes that are more healthy, and this is not true. They contain nicotine as well and are equally as addictive and dangerous. So here's some information from the American Lung Association. It's an organization based in Chicago that was formed in the early 1900s to combat tuberculosis. So as you can see, Illinois receives an F in 2 areas in tobacco prevention, cessation, and prevention and cessation funding, as well as flavored tobacco products. Illinois does not have that many limits on the sale of flavored tobacco products. This includes e-cigarettes as well as menthol. So here's some information on Kane County specifically. The percentage of adults who smoke is over twice that of the target by 2030. And the number or percentage of middle schoolers currently reported vaping is significantly higher than the national average. However, there is a silver lining as lung cancer rates are lower than the state or national average. So some information on our grant activities specifically. We promote the Smoke-Free Illinois Act. Recently, we've been handing out materials to local businesses. These include information on the Smoke-Free Illinois Act, as well as window clings with the anti-smoking and vaping logo on it. In addition, we promote the Illinois Tobacco Quit Line, which is an excellent resource. With one call, you can receive free cessation counseling as well as nicotine replacement therapy products. We assist behavioral health treatment facilities that want to bolster or create cessation programs. We work with local businesses, organizations, and agencies to promote smoke-free outdoor spaces. Most recently, we partnered with a few farmers markets around Kane County to make them smoke-free. And this is the main kind of topic we're talking about today, is where we partner with schools to prevent vaping initiation and encourage quitting. We do this through anti-vaping curriculum that we've been working on with an organization called Catch My Breath, and a smartphone app that we are going to present today. So yeah.
Thanks, Nathan. I just want to expand a little bit on the last grant objective that Nathan spoke about, which is our work with Kane County Schools. The Vape Free Together program brings together schools, parents, students, and the health department, all in an effort to curb vaping initiation among middle schoolers and high schoolers. So some of the benefits to schools are reducing vaping initiation rates among middle and high school students, reducing the disciplinary actions due to vaping on campus, classroom disruptions from students leaving class to vape. We offer some sponsored training and supplies to teachers, and encouraging the communication and collaboration between schools and parents. A couple of activities involved with the program are this vape-free school designation, which we give to schools who incorporate the anti-vaping curriculum into their programs and who incorporate education in addition to any disciplinary responses they have to catching a student vaping in school. There's also a teen-focused anti-vaping resource app that we're working on. Some parent education. For example, last fall, we offered, in partnership with Northwestern Medicine, a webinar that taught parents about vaping products that are hidden in plain sight and kind of look like everyday objects. And then tobacco retailer education. So we're finding that students are able to go into retailers and purchase vaping products. So we want to remind those folks that it is illegal to sell to people under 21 years of age. The anti-vaping curriculum that we're using and promoting at schools is called Catch My Breath, and it's approved by the Illinois Department of Public Health with the goal of preventing the initiation of e-cigarette use among middle and high schoolers. And we just want to communicate to students that, most of the peers do not vape, even though it may seem like many of them are. Identify reasons why young people might start using e-cigarettes. Recognize the subtle and not so subtle messages in advertising, practice skills for resisting peer and advertising pressure to vape, and then for them to discover their own reasons for not vaping. The teen-focused anti-vaping resource phone app it's in development with students from the Illinois Math and Science Academy, so it's very student-led. It'll have information on vaping dangers, nicotine, a list of things to do when you are feeling that craving to vape, and then some resources that are local here in Kane County and nationwide that might help teens with the stressors that might influence them to vape. And we should have that ready hopefully by summer. Happy to answer any questions.
Thank you for that. Any questions or comments? Dr. Silva?
I would just like to share that in my communication with young people, I hear a lot, oh, cigars don't matter because you don't technically inhale. So I'd like to share with you that that is something that's important to address because that's what they think.
Any other comments or questions?
Madam Chair, if I have a comment real quick.
Yes, Mr. Tarver.
Thank you, Madam Chair. I just want to say, working in the school system, obviously, I'm really excited about this opportunity to help our students. This year specifically, we have seen a drop and decline in the middle school with vaping, but we've seen an uptick in our elementary buildings students vaping on the bus and also bringing them to school. So this is not stopping, and I applaud the efforts to educate our students on the risk and the harms of vaping. So thank you.
Thank you. Thank you for this presentation. It was really interesting. Are you seeing I have a question. Are you seeing a downward trend in vaping among students? I had just heard Mr. Tarver say upward with the elementary school, but are you seeing a downward trend mostly?
We actually don't have the data yet. We get our data on youth vaping from the Illinois Youth Survey, and their last numbers were from 2022. The next one comes out later this year.
Okay, that'd be interesting to see how it's trending. So, okay, thank you. Any other questions or comments? Okay, back to you.
All right, so we have one resolution. So thank you, Tina and Nathan. They're doing a fantastic job with that program. And again, many people think the vaping and it is alarming to hear, as Mr. Tarver said, with the younger and younger kids, it's just something new and fun that kids think is safe. And so we definitely want to get them the information, and peer-led efforts have a really strong evidence base that they're more effective than just adults telling people what they should do. We do have one resolution before you that's related to the app. And this is to give us permission to be able to participate with Apple. So it's authorizing the Kane County Health Department to participate in the Apple Developer Program to publish health-related apps on the Apple App Store. A lot of apps in that. So in order for us to move forward with the students to be able to make this available, we do need to have this several agreements, and sorry for all the paper here, but several agreements that we need to sign. We have worked with IT and the state's attorney's office on this. So they've advised that we just need to bring it forward to get permission from the board to be able to advance this initiative.
Okay, so I need a motion and a second to bring this forward.
I
Yes.
make a motion to approve this resolution.
Tarver
have a-
seconds.
Tarver seconds. Okay, yes.
I
Mr.
would
you have
just
a
like to make
question?
a comment that not only is this like excellent news, but homegrown Kane County IMSA Titans did this, and yay. Sorry, little plug for IMSA.
I think that's excellent. Yes, okay. So any other questions or comments? Other than good job. And I understand it's only the iPhone right now, but it will be more inclusive later.
This will be a pilot. Yes. So we've gotten into all the documentation that you see before us. We're working through this right now. We are working with the students. So we're working. Limit is absolutely not the right word to use, because they're brilliant and very helpful. But working with the time resources that we have. So yeah, if this is successful, we'll look to expand.
Great, great, great. Okay. Call the vote.
Juby?
Juby, aye.
Silva? Silva, yes. Tarver?
Tarver, yes.
Williams?
Williams, yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes.
Tepe?
Steppy, yes.
That passes. Okay, it passes. Okay, is there any old business before us this morning? Mr. Isaacson, did you have anything else you wanted to share with us?
No, we'll have a lot of exciting things for next month though. So
Okay. Any old business? Okay, I'd like to ask for a motion to replace the reports on file.
So moved. Silva moves.
Have a second?
Juby seconds.
Okay, we can take that a voice vote. All in favor?
Aye.
Aye.
Okay, and I don't believe we have an executive session needed this morning. Any new business? Okay, all right. So in honor of Mr. Kenyon, yes, Mr.
I
Isaacson?
just remembered something. I apologize. And this is just an aside, but following up on the great presentation last month, and I just wanted to give Tina an opportunity. The team has put together naloxone leave behind kits.
Oh, great.
And I wanted to give Tina the credit to hand them out, because her team did a great job with Director Peterson. So these are really nice. So I apologize. I almost forgot about that, but just so you can see, following up on the opioid overdose prevention presentation
Great.
from last month.
Great, thanks.
Yeah, please.
Wonderful.
Madam Chair?
I don't know if this is on.
Yes, Ms.
please.
Bates.
Mr. Isaacson, are you bringing that to the Green Fest on June 8th?
Sure.
like you did last year.
Yeah,
Okay.
yeah.
Sign up on our website.
Okay, perfect.
Thank you.
Great.
Okay,
I just-
thanks. Over
Yes.
and out. Thanks.
I also just wanted to say that the Leave Behind Kids, the police departments throughout King County have been super supportive. Some of them have already stopped by our office to pick up lunch for their officers to have when they go on overdose calls for the families and other support persons that are in the home or in the area. So it's really nice to see the great collaboration throughout the county with those police departments.
That was Miss Peterson sharing that with us.
Oh,
this
yes,
morning.
sorry.
And that's good news. That's very good news. Okay, so now, anything else before we adjourn? Yes, Mr. Shepro.
It's beyond my scope, but I remember it was only a few years ago.
Microphone, please.
Sorry. I remember it was only a few years ago when even some first responders were not permitted to administer things that were in their possession. And this represents an amazing change in the law to allow, obviously now, anybody who knows how to use this. And I remember when I worked with the fire district and some police departments were not authorized to use it even if they had the materials. So.
Progress.
Bravo.
Yes, great advancement. Great.
Thank you.
Okay, and so now, do I have a motion to amend? I mean, to adjourn, amend. We've had enough amendments today.
Not amendable, just in case.
Did you motion? Okay, Mr. Sanchez motions, Juby seconds. Everybody in favor